My name is Corey, and we're at the YouthCO AIDS Society office in downtown Vancouver. I'm here to get a tattoo.
I'm Isaac. I'm going to give Corey a tattoo. I've been giving my friends tattoos for a few years, and I'm going to try and do it in a way that can teach people how to give tattoos safely and hopefully effectively. Well, I washed off the table with this cleaner that we have, and then we wrapped the surface that we're actually going to be tattooing on and keeping the equipment on in saran wrap, disposable, that we can just throw out afterwards. And also so this stuff isn't coming in contact with any kind of like bacteria or dust or dirt that might still be on the table or whatever. I mean, it's not foolproof, but it's just a precaution to take. And then I put on gloves. And and then after I took these sterile containers out of the water and put them on the saran wrap, I filled them with as much ink and rubbing alcohol as hopefully we're going to need to use during the tattoos, because that's a total possible contamination risk if these things are both going to be coming into contact with paper towels and the needle that I'm using to actually puncture Corey's skin. So obviously there's a ton of risk of bloodborne pathogen. And then I set everything up on the table: the razor, alcohol swabs, the tape that we're going to use to attach the tattoo needle that I have to the chopstick that I'm going to use as a handle, which we also boiled, and the rubbing alcohol and the ink that are just sort of still there in case we need them, and paper towel.
There's a jug there. So we're going to work on the teacup.
We'll just draw a bunch of ideas. I'll draw things because I'm going to be giving the tattoo, so Corey will tell me whether he wants it to look the same or different. I'll make a final draft, and then that'll be the tattoo. And then I'll draw it on him. Wipe your skin off with rubbing alcohol.
It's a new razor, and no one else has ever used it before, and no one else will use it again.
Especially if you haven't done a tattoo before, you'll find that it often takes a lot longer and a lot more patience to get the ink in to a design than you might think. Basically, the less lines and the less detail, the better the tattoo is going to end up turning out. But especially if it's the first tattoo you've given, you want to start out simple. The simpler is better, and smaller also, because it takes a lot of poking in and out of the skin to cover a lot of ground. So you don't want to try and do anything super big, or it's just going to take forever. We've drawn the tattoo on Corey's arm. Now I'm gonna set up the needle that I'm gonna. I actually have a tattoo needle that has been sterilized and packaged, and it's also really important to remember that no matter what you're using, whether it's sterile or not, it should never ever have been used for tattooing before, and preferably it should have just come out of a package. Okay, so what I'm doing now is attaching the tattoo needle that I'm actually going to be using to give the tattoo to this chopstick that we sterilized. The chopstick is so that I can hold it steady, because this tattoo needle is really thin, and I'm just going to use some electrical tape, which is non-porous, which is a good thing because it's not going to collect plasma or ink or whatever, and we can wipe it down during the course of the tattoo if we need to. The tip of the needle is close enough to the bottom of the chopstick that it's not going to bend a bunch, that it'll still be rigid and not be moving around. You should never use a tattoo needle like this on ever more than one person. This is how I would make a needle. If I didn't have a tattoo needle, I boiled these needles that just came out of the package, because whenever you can, it's always just good to take as many precautions. Boil things when you can, clean them with rubbing alcohol when you can, all that stuff. I usually use chopsticks because, especially when you're making things with sewing needles, they'll have one flat end and you can line things up against them. It also gives you kind of edges to grab onto, so you have a bit more of a grip when you're actually doing the tattoo. Line the needles up against the edge of one side, so there's enough distance from the bottom, the same way that I lined up the tattoo needle before, so the bottom of the chopstick isn't going to get in the way, but not so far that the needle will actually bend back and forth. Often for really fine lines or small tattoos, I just use two or even one. the more needles you use, the faster the tattoo is going to go and the more space you can cover, but the less accurate it's going to be. Just make sure they're like lined up properly at the top and nice and. But if you are going to use thread on the needle, it's really helpful in a couple ways. It can give you something to grab onto, so there's even more grip on the top of the needle, which is really awesome. And another really great thing is that if you wrap it around the top of the two needles, up to like maybe halfway up, not super close to where they're actually going to be puncturing the skin, but maybe just to the middle, they can work as a reservoir and like hold the ink onto the needles so that you don't have to dip them back and forth in the ink as many times, and then that's a tattoo needle. We can actually start giving the tattoo. From the standpoint of someone who's giving a tattoo and who has given tattoos before under the influence of drugs and or alcohol, it makes it so much harder, like way harder than you would think. Like
from the standpoint of someone getting a tattoo, a lot of substances really like change your reaction to pain. So if you're on something that is gonna like heighten your awareness of everything that's happening, and then you're going through something that is painful, then all of a sudden you're having this like heightened sense of pain and like not clear context of like when it's going to be over or how much it actually hurts.
Alcohol especially, and pretty much any stimulant, thins your blood, and so that means that you're going to bleed way more, which means that it's going to be harder to get tattooed, it's going to be less safe, and your tattoo is going to heal way more poorly. So if you have thin blood and you're getting tattooed, it's probably not going to turn out very well at all.
Sometimes your body's reaction to like substances is recognizing that you've put a bunch of poison in your body, and if your body's like trying to flush out whatever poison it is, like
the tattoo goes with
it.
Yeah. Way harder to control the sterility of the environment. Most people don't have access to an autoclave or something that can actually sterilize equipment the way that it needs to be to really like ensure that there's not going to be the possibility of like airborne bacteria or like parasites or other like contaminants like being present on the tools that you're using. And there are ways that we have just used and that you can use to reduce those risks, but if it's a concern, having a sterile environment like a tattoo shop and that has access to an autoclave.
Sweet. Yeah. What should I do like in the next couple days to keep it?
I would recommend that you cover it with something, whether it's like a bandage or even just like tape some saran wrap over it. Right now it's technically still an open wound. That happens, but 6 hours is safe. And then once the bandage comes off, you can wash it again really gently with like a tiny bit of soap and water. There's like a million different methods of healing, but the most important thing is just that if you notice it getting really red or itchy, like it's infected, or if it's scabbing like a ton, like then you get it checked out and make sure you're taking care of it, because it is possible for tattoos to get infected and it's not common, but if they do, it still can be like really bad for you. If it does, just don't pick at it, because as soon as you pick the scabs, you're pulling all the ink that's under them out as when they come off too. So
Totally.
And if you want, you can use a tiny bit of like unscented lotion, like Lubriderm or something. I mean, the more you let it breathe, the better it's going to heal once the wound is initially closed, right?
Cool. Thanks, Isaac.